Okay. What are your hopes for Aboriginal and Torres Strait Islander communities under the Australian Cancer Plan, and do you feel it goes far enough?
My hopes are really that the voices of Aboriginal and Torres Strait Islander people are listened to and that the needs of our sector are really captured in a meaningful way that reflects what those needs are. I think that really involves making sure that the voice is clear and strong through good governance processes that allow Aboriginal and Torres Strait Islander communities to be able to influence cancer policy and programs as well.
And what would you say to everyone here about how to meaningfully engage with this inequity and work with Aboriginal and Torres Strait Islander communities to deliver better outcomes and culturally appropriate care?
I think probably the most important thing is listening, developing relationships with Aboriginal and Torres Strait Islander organisations, and then based on those relationships and that listening, work together to co-design and co-create appropriate ways of working together. So I think really acknowledging the community level activities that occur through the Aboriginal community controlled health organisations is important. But also acknowledging the peak bodies such as the state and territory affiliate bodies who represent various Aboriginal health services across states and territories, as well as NACCHO, the national organisation, to really understand and acknowledge the voice of the community-controlled sector within the work that's being done.
And what brings you hope and inspires you in your work?
Look, it's a real honour as a non-Indigenous person to be involved in Aboriginal and Torres Strait Islander health. I think there is a lot that all Australians can learn about health and about community control through our sector. So I think the privilege for me is really being able to learn and work with Aboriginal and Torres Strait Islander people and develop policy, which I think is really cutting-edge policy, and I think the sector leads health policy more generally globally.
And why do you think events like CanForum are important?
I think it's a great opportunity to really bring a whole range of different stakeholders, subject matter experts together in an environment, I suppose, where decisions are made. And I think CanForum is a kind of a concentrated effort to try to instill this kind of energy in the sector and bring people together. And I think the breadth of presentation and stakeholders here is a real testament to Rare Cancers Australia. And I think it's necessary to achieve outcomes that need to be achieved.
And last question, what does a better world for rare look like to you?
Well, for my perspective, Aboriginal and Torres Strait Islander data being understood in a lot more detail, and that knowledge being understood and led by Aboriginal and Torres Strait Islander people is important through the appropriate governance processes. So I think if we can understand what rare cancer access to trials, to treatment looks like, then the Aboriginal and Torres Strait Islander people who can have that knowledge can decide on what's the most appropriate way to move forward with the knowledge around rare cancers. At the moment, we don't have that information, so it's very difficult for our sector to know what are the most effective strategies.